Behind the scenes, Kieran, there's some accusations regarding Daniel Andrews' government's handling of this crisis. So senior sources involved in dealing with the coronavirus crisis are pointing the finger at Daniel Andrews' government, particularly around testing and contact tracing. So here are 5 reasons put to me as why this has hit Victoria harder than other states. That they were slow off the mark on testing initially, that there was a lack of consistency in testing, that what has been described to me as clumsy contact tracing practices and lack of digital processes to get information out quickly in terms of test results and getting hold of contacts. So in New South Wales, for example, immediately there were outbreaks in Bondi, pop-up testing clinics were immediately put there. Victoria is said to have been slower off the mark with pop-up clinics and with contact tracing and the testing around the outbreaks. Federal government sources have certainly pointed out to me that the Cedar Meats outbreak, the abattoir outbreak a month or so ago, and a failure to contact trace and test around that quick enough as a reason for the community transmission problem in Melbourne. Let's bring up this map of hotspots in Melbourne, which has been the subject of so much discussion since Saturday. Actually, I don't have it, but what I can tell you is that Cedar Meats is smack bang in that Brimham area. It is in that, it is right in one of the 4 hotspot areas. We have had, here it is now, I do beg your pardon. So Brimbank there, Cedar Meats, that's where it is. And look at all the hotspots around there. So we've had 116 new cases in Victoria as of yesterday in the past week, compared to 23 in the rest of the country. Let's see if we have the curve here, because I want to show you Victoria versus, say, New South Wales, the escalation in cases. And as of yesterday, there had been 734,000 tests in New South Wales during the pandemic, compared to 667,000 tests in Victoria. But that Victorian figure includes 100,000 tests carried out in a week, ramped up after the Cedar Meats crisis. That doesn't make sense, sources have told me, as if you don't test consistently, if you do it all in one hit, you do not pick up the community transmission. It's not a virus where you can play catch up on testing, one source has told me. So New South Wales also employed hundreds of extra people to get text messages out to people as quick as they could if they are known contacts of a COVID positive case. Now, we can see the mobility of both states has been similar, Kieran. So Google mobility maps tell us that nationally we are down 16% when it comes to retail and recreation activity compared to January and February, the baseline there. Just 1% down on supermarkets and pharmacies, 14% down on workplaces, but a staggering 40% down on public transport. New South Wales is 14% down on retail and recreation, just 11% down on being at workplaces, and only 6% on staying at home. It's up. So Victoria, 22% down on retail and recreation, 16% down on workplaces and 49% down on public transport. Less people at work, less people on public transport in Victoria, and yet their outbreaks are worse. Well, we've seen what Dan Andrews has had to say. He's been blaming families for outbreaks and poor behaviour, no social distancing. He's requested help this week from other states. We revealed yesterday New South Wales and South Australia have been asked for contact tracers, but also he's asked for doctors, physicians from Queensland. Today he admitted he was getting an army of people out there door knocking in terms of contact tracing. Let's have a listen to that.
This is not about being popular. It's a pandemic, and it's about making the tough calls and doing everything you can to get this right. And this is not exact, it's not precise. One thing for certain, this is wildly infectious, and if people do the wrong thing, even in limited numbers for a limited time, it will spread. We know that. I can also confirm for you that there is literally an army of people going out door knocking. There will be hundreds and hundreds and hundreds of people from our expanded public health team out there door knocking in hotspot suburbs and other areas if that's deemed appropriate. They will do that job providing public health advice, making sure that everybody, where language and those other issues like that won't be a barrier. It is standing up now, but it will certainly expand in the next couple of days.
So perhaps that contact tracing effort should have occurred earlier, especially after the Cedar Meats outbreak. That's what's been put to me, Kieran. On the 27th of March, the week a number of restrictions came in. The decision was taken to quarantine all overseas arrivals. And since then, the number of COVID-19 cases, as we know, across the country has just fallen through the floor until this spike. We know the Federal Health Minister, Greg Hunt, has pointed the finger at the Black Lives Matter protest. Let's hear from him from Sky News this morning.
We know that it's 2 weeks after the protests in Victoria, and whilst only 4 cases have been identified as being associated with the protests, what does appear to have happened is many people looked at that and understandably said, well, surely we can't have double standards where it's okay for 10,000 people to be in close proximity, but it's not okay for 10. But the real point is it wasn't okay for 10,000 to be in close proximity, and nor is it okay for 10 people, unless they're living in the same household, to be physically close.
Now, haven't things ratcheted up between New South Wales and Victoria today? Gladys Berejiklian saying it's okay for ski resorts, restaurants and pubs to refuse service to people from most of Melbourne. In fact, she said, don't interact with Melburnians. It's extraordinary stuff. So Daniel Andrews was asked to respond.
As for resorts and other locations in New South Wales, they are at liberty to accept or reject any traveller. I would encourage businesses not to welcome anybody from those hotspots, because the advice from the Victorian Premier is do not travel interstate if you're from one of those hotspots. And my advice is even stronger. It's do not go down there, and certainly I think it's the prerogative of every business, every organisation not to accept anybody from those hotspots at this time. That is basic pandemic management.
Now, I've had a response from Daniel Andrews' office. They say our coronavirus testing regime here in Victoria is among the highest per capita in the world, 675,000 tests. In the early stages of the pandemic, we invested $37 million on surveillance, and they say they have a disease detectives team of more than 1,000. But they've asked for help from other states, and there's certainly a lot of conjecture behind the scenes that they could have done more, Kieran.